Ramchandra Tekwani. I'm the founder and CEO for Core Mobile. I started this company with seed investment from Citrix Systems in 2011 to primarily enable any user to do their entire workflow from a mobile device. I used to face that problem myself when I was VP and head of worldwide mobile carrier business with Juniper Networks. But that story I'll tell separately. What I did was I looked at how hospitals operate when my son went through surgeries. It gave me an exposure to how inefficient our healthcare system was and how uncoordinated it was. So I patented this technology and applied it to healthcare. Again, that's a longer story. It will tell separately. But where we are right now is we are about 4 to 5 months away from going cash flow positive. We sell through SAP and Dell. Our sales teams are essentially the sales teams at these two partners. So that's what we do. Now, the pain that we see happening there is in acute care as well as post-acute care. If you look at the hospital, what their motivation is in looking at us is primarily the need for increasing patient throughput. If you look at the process that these have to go through from check-in to admitting to pre-op, each of those transitions take time, and time is lost between them. They have devices. It's not like they don't have devices. They have devices, but they are not coordinated, and there is no real-time visibility. I'll give you an example of a hospital in New York City. Patients, after they get admitted, they actually get lost because they put them on this bed with wheels on them, leave them outside the OR while the team is doing a huddle, and then the patient gets out of bed, says, I have to go to the bathroom. He goes out, and then somebody comes along and says, why there's an empty bed in the hallway, and rolls it into the storage. And then this patient goes around looking for where he has to go, and the patient is lost. Essentially, loss of efficiency, loss of productivity. The way they actually operate there, this is a view from a major hospital in New York City. I was there yesterday. What we do is we go look at the site, and this is how they operate. And their analytics are on paper. Same-day analytics, they club it in there, and this is like a 1,000-bed hospital in New York City. It's a huge 20-story hospital. So that's how hospitals operate. So that's the major pain. Now, when you go from acute care to post-acute care, now, if you're in acute care, you somehow make it through the system. Once you're in post-acute care, it needs to be coordinated between the hospital to the primary care provider, to the home health care provider, and then the patient itself. So there is a need for coordination, remote patient engagement, and discharge instruction compliant. They're taking medications. Now, why it has to be done is because there are penalties now. If a patient gets readmitted, there have to be penalties. If you look at how serious is this problem, it's serious because if you have to build a new operating room to increase capacity, it costs $3 to $5 million. If you look at how much it costs to operate it, it's $376 a minute. Right. So when we save 5 minutes, it saves them more than $1 million.
All right, Chandra, thank you very much. Let's move into the questions. Who's got the mic? Let's start with Missy.
The mic?
You have a mic here?
Yes.
Chandra, it's so great to meet you. I've actually seen you around town and seen your solution. It's a really hard thing that you're doing, putting workflow on the mobile device. I come from the EHR and PHR world, so talk to me a little bit about how you're getting the data out of the systems of record. So is it HL7, and how are you making that happen so you can display it in real time in mobile?
So the question is, how do we get this information from existing clinical systems? Mm-hmm. How active it is? The patent that we filed, after 3 years of work, we got it granted, is actually to correlate information based on context. So what we do is we don't wait for the provider to ask for it. If the patient is on schedule, we pull it out from multiple clinical systems. Mm-hmm. If the provider is at a certain location, based on location in the hospital, be it GPS location or Wi-Fi triangulation, based on that, we pull it out. So based on context, we pull it out ahead of time so that the provider has instant access to it. Now, what is the mechanism we use in the back end? We are completely mechanism agnostic because the patent is in how to deal with information in various formats from different places and do it in a manner that they can be consistently treated based on context. So actually, our patent is on that. So how we do it we're using HL7, we do it using WSDL, we use it using REST APIs. We have integrated about 40 systems now, and diverse, Salesforce, Siebel, Business Objects, all sorts of places. So historically, we started in field sales in 2011, went cash flow positive in 2012, end of 2012. And then we got into healthcare, and now we are looking to go cash flow positive in 2015.
Got it. Fantastic. Congratulations.
Thank you.
Really nice presentation, and I'm a huge fan of sort of purpose or sector-built CRM, or in this case, sort of patient PRM. I think you can have a much more empathetic product for your end user. What concerned me in your presentation is that you've got a value sort of a VAR relationship with SAP and Dell, which puts a distance between you and your end user customer in terms of really understanding implementation, use case, and empathizing in your product design to make the best solution. Talk a little bit about that, please.
Yeah, so let me take you through the team, how we are structured. Further, yeah, so go ahead. So the way we work is we sell through the sales teams, but we have a partner manager who works with them, who's very technical, who's a solution manager. Then we have sales advisors both on East Coast and West Coast. And we have an advisory board of anesthesiologists, surgeons, and administrators. So the advisory board actually gives us visibility into what is going on there. These partners, SAP, Dell, Cisco, and Infosys, they have no visibility into how hospital operations happen. But what we do is we go in there, we need a salesperson to go book the order. Otherwise, getting approval from, getting on an approved vendor list of like NYU and Mount Sinai, it's a huge task. It just blows through all that. That's one part of it. The other part of it is they have dedicated inside sales teams who open opportunities for us. We can't afford to hire like 20 salespeople. So what we have done is we use their inside sales teams, work with them to open the doors, go do the trial. When the production happens, they place the order on SAP or on Dell. They don't place the order on us. We give them 25% margin. SAP is on revenue share. Dell is actually more interesting because they carry us on their price list. So the sales guy gets quota relief. On SAP, the sales guy gets spiffed. They have non-quota compensation. So what we have done here is we have kept our costs low and focused on what our core expertise is instead of trying to get all the field operations. Do we get exposure to how they operate? Yes, we have that.
Let's move on to John Garrett. We have 1 minute left for both our questions.
Did I answer your question? Okay.
A quick real-world example of how a customer has used this and is translated into the epic proportion savings.
Yeah, let me go through that. Yeah, go ahead.
Somewhat. I'm curious how you, who is your actual end user and how do you motivate them to input data? I mean, nurses and physicians are notoriously...
So how do we motivate them to
Yeah,
use it? They are desperate to use it. I was just there in New York City yesterday. I came back. So the question is, how do we motivate end users to use it? I was in New York City yesterday. Mount Sinai, major hospital, the end users were asking me, how long does it take to get it up and running? Is it I said 2 to 4 weeks. They said, okay, 2 to 4 weeks. The reason is the same thing. They are completely lost. Different people have different motivation, but nurses want to know where the surgeon is, where the anesthesiologist is. Surgeon wants to know where his patient is, when he's going to be ready. Everybody wants to know when they can perform their task. This gives them visibility on when they have to be ready to perform on the patient. Downstream, as soon as they register, we can tell you who has to be ready when, and when they are likely to get discharged. Right. That's the power of analytics.
All right.
I didn't answer your question,
Chandra.
but separately.
We're all out of time, but thank you. Thank you very much.